Michael. So
I'm
to have you on the call.
challenged. I'm very sorry that
No.
I caused all this problem. I really am.
You're a fighter.
Listen, I have been a fighter all my life. It's the way I was raised as a child, as a young adult. And as you know, Bill and Joey and the rest of the people who know me, I'm a never say die individual. So I'll give you an encapsulated version of how I was introduced to this.
Thank you.
Okay. So as you pointed out, because I've been listening and I've been on, I just haven't been unmuted, which I finally am now. I was an athlete. I was very actively engaged in life. I embraced life every morning with positive affirmations.
And we rode on the same roads in Florida. Don't forget to say that.
Right. Yes, we have ridden on the same roads in Florida. Anyway, I had to fight for everything I've done all my life. And so I did my doctorate at Oxford. I came back to the States. I was trained analytically, and then I got involved in behavioral and cognitive interventions in my office. I really am a trained clinician, but I also do a lot of forensic work. And I have a big specialty in not just pain management, but in hypnosis. And I also do something called audiovisual entrainment and cranial electronic stimulation. And for those of you that want to find out more about that, I can send you to a website and you can find out how this coincides with people who are doing what I'm doing. So I work with a very diversified population of individuals, and I use a multimodality of interventions. And back in 2015, as Bill pointed out, I was riding on one of our common roads down in Florida and thought I was experiencing a heart attack. I became very short of breath, and I was only going up maybe a 30-degree in grade that was a drawbridge. And I got to the top, and I questioned whether or not I should get off the bicycle because I clip in. And I said, you know what, it's all downhill, so let me just go down and see if I can get my breath. Bottom line was, I was so flustered by the time I got to the end of the ramp that I failed to unclip, fell off my back. I displaced my middle finger on my right hand. It was at a 90-degree angle. This was on New Year's Eve, and I know I'm making this a long-winded story, but it's relevant. I ran to the emergency room. The emergency room physician could not straighten it. We called somebody about 50 miles away south of where I am in Florida, and fortunately, he was a specialist in terms of hand surgery. He was a hand orthopedic surgeon. He used some kind of a combination, told me to close my eyes and pray, which I did, and we avoided surgery. But what we never found out, because I would have been admitted for surgery that night, was that I was developing leukemia. And I was probably 190 pounds of solid muscle. Worked out all my life, did 110-mile bike rides and all sorts of things, ran the New York City Marathon, came back to New York, saw an oncologist, hematologist. He confirmed that I had AML, said we have to start right away in terms of treatment. I went into outpatient. I knew at that time, because of my positive thought process, that I was going to beat this, but unfortunately, my mutations were such that it required, if I was going to really win the battle, I needed a bone marrow transplant. And so I researched, went all over the country, interviewed a lot of physicians, and wound up at New York Presbyterian, and had a very successful bone marrow transplant. Unfortunately, my immune system was compromised, and about 6 months post the bone marrow transplant, I was sitting in my office. I started seeing double vision with the patient. I called up a friend of mine who's an ophthalmologist. He said, Michael, get back into the city. I saw a neurologist, and she said I had the rarest variant of Guillain-Barré syndrome. So here in 2 years, I was smacked down twice, and there was a sense of disbelief on my part. But again, I said, okay, well, what do we have to do to get rid of this? And they tried all the traditional interventions, IVG, plasmapheresis, and everything else. Unfortunately, because of my variant, I wound up, as you pointed out at the beginning of the meeting, I wound up a quadriplegic. I could not even move a muscle in my body. I was unable to talk. They had to sew my eyelids closed to prevent my corneas from being damaged. And for 8 months, I had to live in my head, and I used every psychological mechanism that I knew of to maintain my fortitude and positive thought process. I was able to hear, but I was not able to do anything else. Fortunately, there was a very young physician on staff who applied for a grant to use a drug called eculizumab, which had never been used before in the application for GBS. And I was able to get the grant. It was a once a week for a month treatment. I started to move, but when I left the hospital, I had 5 different physicians from 5 different specialties tell my wife and myself that I'd probably wind up in a motorized wheelchair for the rest of my life, which was completely unacceptable. Now, the problem that I encountered when I was at the hospital, and this is important because this is where the Avacen comes in, is that in spite of my wife's protestations and a good friend of mine who's an orthopedic surgeon, they never sent any OT or PT to me for the first 3 months. So my entire body, other than wasting away, contracted. My hands and my feet were completely contracted, and they thought that that's the way I was going to remain. You can see right now that that's no longer the case. The only problem was that the contractions in my feet were such that even speaking to a number of surgeons at the hospital for special surgery in the city, they said that the surgery to correct my feet could result in a drop foot, which would be worse than what I have right now. And I fortunately was able to receive very effective PT and OT when I got home, and progressed to an outpatient clinic. And through my own determination, have been able to stretch the heel cords in my legs and the gastrocs so that the heel I was on a platform heel because I was walking on my toes because I can't dorsiflex my foot. And so even though they said it would never happen, it's taken a while, but the heel cord is beginning to stretch down. The platform is much lower right now. And as you pointed out before, Bill, I am walking with canes. Now, here's where Avacen comes in. I'm not sure how many of you are familiar with Guillain-Barré. It's a very, very devastating neuromuscular disease, probably similar to MS and muscular dystrophy in a lot of different ways. They're not really sure what causes it other than a virus. You can get it from something as simple as a flu shot. And so Michael Ladd, who has been a friend of mine for over 30 years, and he called me up about 6 months ago. And during the time of my recovery and rehabilitation, every morning I would wake up and from my elbows down through my fingers, I felt I was in a vice grip. The muscular tension and the neurological pain was on a scale of 1 to 10, I would say probably between an 8 and a 9. It would take me hours to be able to relax those muscles, and using of course, outside medications and everything else for the pain, which I didn't really want to do. I'm very much a naturopath and an integrative thought process person. Allopathic medicine has its place, but I believe homeopathic medicine has its place. And as Joey said, I was a nutraceutical taker for years and still do. And so Michael called me up and he said, Michael, I have been introduced to a Class II medical device, FDA approved. He explained the process. He said, why don't you give it a try for a month? And I'm a very open-minded individual. I said, I'll try anything to progress and rehabilitate myself even further. And after about a week's usage, I found myself waking up in the morning, and the period of time that I was immobilized in my hands and my arms started to shorten. And by the end of the month, I can tell you that my pain level now, when I wake up, is a very modest 2. I'm not even aware of it any longer. The only thing I can ascribe this reduction of pain and my rehabilitation to is the Avacen, because there isn't anything other than that I have used as an intervention. I can tell you as an aside, my wife as well uses the machine. She's an athlete, and she has a little bit of arthritis in one of her hips, which has been very manageable at this point in time. But when we went down to Florida to visit our home on one trip, we forgot to take the Avacen with us. And after 2 days, just 2 days of not allowing ourselves to be treated, there was a noticeable change in our pain level and discomfort. And we couldn't wait to get home. We thought about sending it down, but we thought maybe we'd cross in between our trip. And I can tell you right now that I've used it with some of my patients. I have a patient of mine who unfortunately has had both Hodgkin's and non-Hodgkin's lymphoma. And he's had a bone marrow transplant as well. And unfortunately, he's been left with neuropathy in his legs. And he just unfortunately was re-diagnosed. He had a resurgence of his non-Hodgkin's lymphoma and had to have some immunotherapy, and started experiencing a lot of pain in his legs again. And I let him try the Avacen in my office. And in one treatment, he said that he was able to receive relief, and asked me how he could purchase the machine. And he's been using it twice a day, sometimes more, and told me that his neuropathy is hardly noticeable anymore, and his, of course, attitude about life is now regenerated in terms of process. Let me bring up one other thing, and then I'm going to go because I'm too long-winded right now. I had a new patient introduced to me yesterday by a prior patient of mine. It was her mother. Her mother's been in terrible pain with her back, has seen specialists all over New Jersey and New York, and has basically been told she has 2 bulging discs in L4 and L5, and there's very, very little they can do. There are other psychological intervening variables that I realized exacerbated the level of pain, because every doctor said that the pain level she was expressing was really not in concert with what the defect was. She went to see another spine surgeon the other day who said it's not bulging. She has herniated discs. She does need surgery. But besides doing psychotherapy that lessened her pain because it was exacerbated by her own emotional state, I allowed her to use the Avacen for 15 minutes. And the beatific look on her face when the session was over, and the lack of very sharp pain that she was experiencing when she walked into my office now was gone. And her other child, the one child that introduced her to me is an OT, but her other child is a chiropractor in New Jersey. And he called me already and asked me how he can secure this machine because he wants to interface it into his chiropractic practice. So I know it's been a long-winded journey. I'm sorry for that. I'm sorry that you all had to put up with this, but I really wanted to make emphatic how much I believe in this product. When I brought Richard Carlton, Dr. Carlton, on board, and he explained to me more from a medical basis why the system actually works, it reinforced in my mind that the application of this device for a variety of usages in both the medical and allied medical health field is we're pioneers. We're at the beginning of something that I think is going to be larger than almost any other medical device that has been presented in the last 5 years. And I'm looking forward to being part of that and part of this group.